Good evening, everyone, and thank you for joining us for the 2021 Healthcare Advocacy Series, co-sponsored by the Tennessee Justice Center and the University of Tennessee at Knoxville College of Nursing. My name is Catherine Crawford, and I am a nurse and doctoral candidate at the University of Tennessee College of Nursing. I will be facilitating tonight's webinar. Tonight's session, Advocacy 101, is the first in our three-part series. Next Thursday's session will take a look at the 2021 healthcare landscape in Tennessee, and the third session on January 23rd is a media engagement workshop with Dr. Carol R. Myers. Details and Zoom registration links for these two events are available at tnjustice.org, and I will post the links in the chat below. A few items to go over this evening before we begin. We are live tweeting tonight's event with hashtag TNHealth2021. So if you are on the Twitter sphere, we would love to see you post about the event using this hashtag. So that's hashtag TNHealth2021. I will be monitoring the chat and will capture questions and comments for the discussion at the end of this presentation. We will be recording this evening's session and uploading to the Tennessee Justice Center website for on-demand viewing. Okay, let's go ahead and jump into tonight's topic, Advocacy 101. I am honored to introduce tonight's presenter, Kanika Young from the Tennessee Justice Center. Kanika is a lawyer and health policy advocate who frequently speaks on issues concerning access to healthcare, focusing on the role of public benefit programs to help people who lack adequate resources to meet their needs. As the Senior Director of Health Policy and Advocacy at the Tennessee Justice Center, she leads efforts to build a movement across the state to protect and strengthen the safety net for children, families, seniors, and people with disabilities, and move towards the equitable allocation of resources to all Tennesseans. Since joining TJC in 2017, Kanika's work has helped Tennesseans understand their role in ensuring that every child has a healthy start and that every person has a pathway to reach their full potential. She is a certified Building Strong Brains trainer and a member of the leadership team of ACE Nashville. Kanika began her legal practice in 2006 with Bass, Berry & Sims PLC and became a member of the firm in 2015. Her practice focused on healthcare disputes in which she represented hospitals and healthcare providers facing managed care payment disputes with third-party payers. Kanika is a native of Montgomery, Alabama. She graduated from Florida A&M University with a degree in political science and earned her Juris Doctor degree from Tulane University Law School. Kanika is a very distinguished member of the health advocacy community, and we are so pleased to have her presenting this evening. Kanika, I will now hand the presentation over to you.
Thank you so much, Catherine. Good evening, everyone. Thank you so much for joining us this evening. I will be speaking to you about Advocacy 101. I'm going to turn my camera off just so you don't have this distraction of my talking head on the slide. But feel free to, as Catherine mentioned, type your questions into the chat or Q&A box, and I'd be happy to answer them at the end. So let's just jump right in. First, I'd like to give you an overview of the Tennessee Justice Center. Our work kind of falls into three different buckets. One, we do individual casework representing clients all over the state. The second bucket is training and technical assistance. We do a lot of webinars. We used to do in-person trainings when that was safe to do, and we hope to be able to do that again in the future. And we also partner with other agencies that serve families in need to share information about the systems that impact our clients' lives. And then the third bucket is advocacy. And so most of my talk this evening is focused on the best practices that we've learned over the course of the last 25 years in advocating for improvements to systems and policies that impact our clients' lives. So a little bit more about individual casework. We have assisted over 1,700 clients just in the past year. We typically serve that many clients each year. And we have full-time advocates on staff that include lawyers and non-lawyers. And we also rely on volunteers, including other attorneys who work at private firms or other agencies who want to provide pro bono service to help our clients. We have many areas of focus concerning healthcare, living supports, and food security. And so the cases that we handle kind of touch on all of those different basic necessities of life. So for our training and technical assistance, we provide ongoing trainings to keep our partners up to date on the latest rules, regulations, and practice tips for people who work in the same program areas that we have gained expertise in. We often offer continuing education for social workers, attorneys, navigators, and assisters, and again, providing technical support to partner organizations to help them navigate the systems that impact their clients as well as ours. And so on our advocacy, this is really my main focus as the leader of the advocacy team. We really value the experience and voices of community members. And we believe that when community members are educated about issues, they are in the best position to advocate to policymakers and other decision makers about policies and programs and how they actually impact real people's lives. We focus on amplifying the voices of people with lived experiences and other experts, such as healthcare providers, because we know that they have the knowledge and the personal stories that really can move policymakers to understand issues in a different way and to center people in their decisions. We also work to mobilize grassroots to get people to use their voices and lobby their leaders to make decisions that are in their best interest and well-informed. And we also do direct lobbying as an organization. So what is advocacy? Basically, advocacy is using your voice. If you've ever spoken up about something that wasn't right to get it fixed, or spoken up to stop something from happening that would be harmful, then you're an advocate. Advocacy is basically speaking in support of or in opposition to a cause, policy, or issue with people who have the power to do something about it. And that part is central. You really have to direct your comments to the person who can really influence an outcome that you're trying to bring about or prevent something from happening that you know will be harmful to yourself or others. There are some common advocacy strategies that we typically use. Grassroots organizing is where you get the average person, your neighbors, anyone in the community to use their voice to let an elected official know how they feel about a particular issue and to get them to vote for or against whatever the issue may be. Grass tops organizing is similar, but it's a little different because that effort is focused on people who are in positions of power but aren't necessarily elected officials. So that would be, for example, the pastor of a church. It could also be a doctor who has a private practice and can speak about their patient's experience with a particular policy or program in mind. So grass tops are essentially community leaders who work closely with community members and tend to have the knowledge and the expertise that policy makers are more likely to listen to and to give credit to. We communicate with legislators via different means, including letters, calls, meetings, and symbolic actions. Symbolic actions meaning protests or marches or demonstrations to bring attention to an issue that has a more public presence for people to notice that this is something that people are mobilizing around and needs to be paid attention to. Media coverage is really important in our work. The media is a very helpful partner to share information about various issues. We try to get earned media, meaning getting our names in the paper to connect to an issue or being cited as experts on a topic. Whenever politicians make decisions, it's often nonprofit organizations and advocates like the Tennessee Justice Center who reporters will turn to break things down and to explain things in a way that the average person will understand. So that's an important relationship that we rely on to advocate. We often ask our activists in our networks to submit op-eds, that stands for opinion editorials, as well as letters to the editor. So this is content that people can submit to their local papers to voice their opinions about a particular topic and to hopefully get more elected officials to understand that the people that have hired them, their constituents, are trying to convey how they feel about an issue, and also to reach like-minded people to kind of grow a groundswell of support or opposition for the topic. Another really important area for media coverage is social media, and I'll talk a little bit more about that towards the end, but I really encourage you, if you're interested in learning more about media engagement, to check out the third event in the series where Dr. Carol Myers will conduct a workshop about that. And then the last kind of key advocacy strategy is storytelling. And I'll go into more details about that, but essentially having people who have personal experience related to a policy or program to share their experience with policymakers is really powerful way to persuade action. And advocacy essentially is persuasion. It's really important to understand what will move someone to join your side and to see an issue from the perspective that you're trying to convey to inform the decisions that they make. And so figuring out what's persuasive is really important. In our experience, storytelling is a persuasive way to move someone. Having a relationship with the decision maker is also key to persuading them, and making concise arguments about the issue is really effective. It's not as effective or persuasive to just be a policy wonk and to rely too heavily on statistics. Statistics definitely have a role in advocacy, but they should not be the focus. It's more effective to move people emotionally than intellectually or in theory or data-driven facts. And so one example here is a picture of a client that we worked with who has been a carpenter and a bricklayer since he was 14. And for 6 years, he served in the National Guard, but he doesn't have health insurance. And when he recently fell off a roof that he was working on, he broke 26 bones and suffered brain damage, but he can't get the neurological care he needs. So he's left without any help. Sharing those details about his personal story is a way to let policymakers know that your decisions about health coverage have real life implications for people like Donald. And so having those stories in front of policymakers is a key way to persuade them to change their positions on different issues. Does communicating with elected officials and candidates even work? Absolutely. In our experience, it is the people who really have the power to move their elected officials. As constituents, many may be surprised to know that you have more power than lobbyists, because the constituents are the people who actually put elected officials into office, and you have the power to remove them from office. One example that's depicted here is in 2017, several children with serious medical needs met face-to-face with members of Congress to lobby against efforts to dismantle the Affordable Care Act. The children participated in some of the most effective lobbying on this issue and were really instrumental in preventing the ACA from being repealed. Lawmakers actually said what really sank the legislation that was trying to dismantle the ACA was the outpouring from constituents, and few were as influential as the little lobbyists who pleaded for their own lives and the lives of other children with special needs. There's also been research conducted where staffers of Congress, 260 staffers were surveyed, and most of them were in management positions. And when asked about various groups and strategies that influenced their member of Congress, 46% said that in-person constituent visits would have a lot of influence, compared to 8%, which said the same of a lobbyist visit. And so a lot of people may be surprised to hear that. Questions at town hall meetings and letters to the editor also have some or a lot of influence, according to the staffers who were surveyed. And there were nearly identical percentages of staffers who said individualized postal mail or emails would influence an undecided member of Congress. A lot of times, members of Congress and even your state legislature don't really hear a lot directly from constituents. You may be surprised to know that. So when they do get a personal letter or a phone call, it stands out in their mind because it's not very common. So communicating with decision makers, it's really important to build a relationship and connect with the elected official. And it really is common sense. Elected officials are people too. And so in your job, if you had strangers reaching out to you or coming up to you and asking you for things or demanding things, it may be a little off-putting. But if you have a customer or a client who builds a rapport or builds a relationship, it's more likely that you will engage in a dialogue and a conversation and be open to hearing their perspectives and listening to what they have to say about an issue. Persuasion. I can't emphasize that enough. It's important to figure out what are the most important issues that the decision maker faces in their position, and what issue is he or she passionate about? And do you have a personal connection that you can identify to the issue that you're advocating around? That is very helpful. We work a lot with a national advocacy organization called Community Catalyst, and they have explained that as advocates, it is our number one job to make it easy for decision makers to give us what we want. If you can figure out what might be in it for them to support your issue, that's the best means to persuade them. For an elected official, you really want to know what is the geographic area that he or she represents, because it's important to make sure that the people that you bring before them live in that geographic area, because they want to know that they're hearing from constituents. And it's also important to understand the geographic area if you're talking about an issue, for example, like a hospital closure, to know that the hospital is in that elected official's district. For an appointed official, you want to know what is the scope of his or her responsibilities, including committees or subcommittee appointments. Who does he or she oversee, and who do they report to? What are the most important issues that the decision maker faces in his or her position? Again, what do they care about? That would be a key way to figure out how to persuade them. Knowing whether the decision maker is in support of or opposed to your position on the policy is important going into it. You don't want to spend your time trying to convince someone who is already on your side. So you want to know that going into the situation and focus your efforts on the people who are on the opposite side of the issue to try to bring them over to your side. Also, it's recommended that you utilize the information you've gathered to identify possible pathways of influence to that decision maker. Who do you know who might have a connection, either direct or indirect, to that decision maker? Can you tap into that person's network or call on them to come along with you to use their influence or their relationship with the decision maker to support your cause. You want to know what support of the issue provide a hero opportunity. That is a chance for the decision maker to look good to his or her constituents or community members. Paying attention to what the official or candidate says in the news is also important. We often use Google as a way to keep updated on what elected officials say. So setting up Google alerts for the official or the candidate that you're trying to influence is a good way to stay on top of what they have said publicly about the issue. And it's really important to pay attention to local media outlets in your area. So when you're speaking to the legislature, focusing on storytelling, the relationships, and making concise arguments again is important. And listening is very crucial in order to be responsive and have a dialogue with the elected official. You want to focus on making personal statements from your experience using I statements, again, focusing on the heart and not the head with really heavy reliance on statistics. And you want to include a shared moral value in your message with the decision maker. It's important also to make a single ask and not demand too much going into the meeting or the conversation. So a little bit more about stories. Stories are the most compelling content for digital organizing in particular. I know especially now that many people are working from home and not gathering in person, we rely even more on digital organizing and social media. And if you're scrolling through your Facebook feed or Twitter or what have you, the things that make people stop and take notice are those personal stories, are the pictures of real people sharing something that has happened to them. So again, numbers don't win people over. It's really the connection to the real life person. Having someone share their firsthand experience is really important, and that can happen in various ways, including op-eds, LTE, which stands for letter to the editor again, and social media accounts. And those are easy ways to get a message out because they can be shared or retweeted over and over to have that message amplified by different groups and organizations. One example that I'll share is with our Katie Beckett waiver advocacy. We partnered at the Tennessee Justice Center with colleagues at the Tennessee Disability Coalition to bring about this really important program to serve children with special healthcare needs. Tennessee, up until recently, was the only state that did not have a program for children who had really complex healthcare needs, but they didn't qualify for our Medicaid program because their parents were over income. And so over the years, we had been working with families who were seeking some support for their children because they could not afford various therapies or really expensive medicines or equipment for their children, even if they had private insurance. And we would have to tell them, I'm sorry, but you're over income for our Medicaid program. If Tennessee were to adopt this Katie Beckett waiver, then your child could qualify. And so we had been hearing those stories and having to break that bad news to families over the years. And when the opportunity presented itself to again fight for a Katie Beckett waiver in our state, we were able to mobilize those parents who we had been in contact with to share their story in the newspaper. Elected officials in our state legislature saw those stories in the paper and decided to take up the issue. And through grassroots lobbying and also direct lobbying, we were able to get this program implemented. And so the program, which has just been rolled out at the beginning of the fall of last year. And we are so pleased to have this opportunity for kids to get the healthcare and the supports that they need. And this would not have happened but for brave parents being willing to step up and share their stories about how they were struggling to meet their kids' needs. So some ways to contact representatives. Some key ways are phone calls and letters and emails. So a couple of tips on phone calls is to be respectful and to make sure to state that you are a constituent, explain your personal story and keep it simple. For letters and emails, it's a good idea to outline the concern and state right up front the topic of your letter or email at the beginning. That's helpful for the elected official representative to be able to get for their staffer rather, to get the letter or email to the right place and make sure that the right eyes are seeing it. You want to explain why the issue that you're writing to them about is important to the community, and you want to be sure to request an action. Some sample language here is you can say, as a concerned constituent, I urge you to support or oppose XYZ, and state what it is that you are concerned about. And you also want to provide your name and your address. And that again is important, so the elected official knows that you are a constituent in their district. Value-based messaging, we mentioned earlier about making sure that you include a shared moral or value in your conversation with the policymaker. And value-based messaging is something that really ties into things like ideas of fairness, justice, liberty, freedom, treating your neighbors the way you would want to be treated, those basic things that you're taught as a first grader about how people should treat each other and what should happen in a civilized society. So harkening back to those basic messages and infusing that in your conversations with elected officials is a great way to find common ground. Sometimes that doesn't work. And so what do you do when a representative isn't agreeing with you? The main thing is to listen. Try to figure out if there's some misinformation that the person has about the issue that you can correct, or something that you can build on to get them to understand things from a different perspective. You want to acknowledge the complaint or disagreement and provide real information to counter whatever it is. Oftentimes, the best you can do is finding the lowest common denominator that can move you towards the outcome that you're advocating for. Again, sharing your experiences and stories, and never give up. Going back to the Katie Beckett waiver example, we had been working on trying to bring about that program for many years before it finally happened last year. And so it's important to not give up on an issue. Each legislative session is a new opportunity to advance the ball on what you're trying to accomplish. And even if you aren't successful in moving them to your side that time, you may be able to reduce the intensity of their opposition, or to prevent them from working as hard against your cause. And this can be crucial. So speaking up is important. People speaking out in local districts really does matter. Civic engagement is more popular now than it had been in previous years, but it's still few and far between that policymakers are hearing directly from people about issues that matter. Candidates are especially listening right before elections. Again, they're trying to keep their job or be hired for a new job. And as constituents, as voters, you hold that power. And so that is a great time to make sure that the candidate that you are considering will actually represent your interests. Even hearing from one person can make a difference. I've heard lawmakers say that someone contacted them, just one person, and it motivated them to sponsor a bill to help that person. Because, the idea would be that if one person is experiencing this, it's probably a bigger issue for more people in the district. The local newspaper is really important. I know personally, I haven't held the actual newspaper in a long time, but there are people who still read the newspaper, even hard copies, but especially online. And so knowing that elected officials are reading the information and keeping that audience in mind as you're submitting your op-ed or your LTE is a great way to influence them, even if you're not having a direct conversation with them. You want to visit the website of your local newspaper to get some tips about submitting an op-ed or LTE. Each paper is a little different in terms of word limits or different elements that they require to be included, such as a photo of the author or a byline and that sort of thing. It's also helpful to build relationships with reporters. We know that there are certain reporters locally, state level, and nationally who focus on healthcare issues. And so if something comes up that we think the public needs to know about, we can pick up the phone or send an email to that reporter and say, hey, I have a story or I have an issue that I think you may care about. And so it's important to make sure that you're pitching those stories to the right reporter and not sending a story related to education or criminal justice to someone who's focused on transportation or housing, for example. A little bit more about media coverage. Op-eds typically are around 300 to 500 words, and they are great to show expertise on the timely topic that's in the public eye. They usually do require a headshot and a short bio. For the average person who's not sort of in a position of being an expert on something, then LTE is another way to get your voice heard in the paper. Those are typically shorter, about 250 words or less. And the LTE section of the newspaper is one of the most frequently read sections. You can either respond to a timely news topic, or you can show the editor of the paper that there are a lot of readers interested in something and that may lead them to cover it in the future. A little bit more about media coverage. Calling radio shows is another option depending on where you live. If there's a radio station that provides an opportunity for calling in, and these are just a few tips for how to do that. And we'll be sure to share a copy of the slides with everyone who registered, so you can go back and look at these tips in more detail. So digital organizing, as I mentioned, this is a really important way, growing more so nowadays because of the pandemic, to use online tools to share information. Typically, we focus on Facebook, Instagram, and Twitter, and they have different uses depending on the content and the audience that you're trying to reach. So for Facebook, it typically is older users, and I guess I'm in that category now, although if you were around when Facebook first came into existence, you've grown up with Facebook, and so it's kind of hard to consider yourself an older user, but that's what it is. Younger users are more drawn to Instagram nowadays, and it's more photo driven, and then Twitter is really for your high volume posts where you're sending short snippets of information, and it's really a great way to connect with reporters, follow news trends, and post about breaking news. So a little bit more about each of these. For Facebook, we find that the Facebook groups are really a great way to do digital organizing. You can connect with local groups depending on the topic and finding things that are of interest to the group. I think Facebook has been running commercials. I've seen them about all the different types of groups that they host on the platform. So whatever issue you can think of, I'm sure you can find a local group or a Facebook group that is focused on that. We also use Facebook to share video content. That's another way to engage people around a topic. For people who may not want to read some long post about an issue, they may be more likely to click on a video and listen to someone talking about that issue. They tend to go further than other posts, but it's important to keep them short, to make sure that you're holding on to people's attention. Facebook Live is a good option for longer events We have done forums where we streamed them on Facebook Live for people who weren't able to come and attend the event in person. And it's also a good way to record the events and the conversations for later use, especially if you want to try to pitch stories to the media. Photos are really crucial, especially photos of people's faces. It's more likely that if someone is scrolling through Facebook, they'll stop on content that includes a photo. One tool that we found that's pretty handy is creating shareable graphics or images using Canva. And there are options for a free account on that platform for you to go in and use their service to create those images that can be shareable. Sharing posts and getting others to share posts is a great way to grow your audience and to grow momentum around the issue that you're advocating about. And we definitely encourage everyone to follow TJC's Facebook page and share our posts. Instagram is another platform that we use, and it's great for sharing photos and short videos, and also telling stories about people who are impacted by the issue that you're advocating about. We recommend posting no more than once a day as it relates to advocacy topics, because Instagram is seen more so as a fun site, and if you're posting about serious issues, repeatedly, you may lose that audience. You can easily link your Instagram to Facebook, and Instagram, one downside is that it's not good for posting links unless you use Instagram stories, but keep in mind that they expire, so you have to save them to your highlights if you want them to stay on your profile. And then Twitter is the last kind of platform that we really use more and more these days. We often live tweet events, as Catherine mentioned earlier. We're live tweeting this event. It's a great way to create buzz around your topic, to create trending topics. And if you're hosting an event like a forum or a panel discussion, if you have written talking points or you've received drafts of the speaker's remarks, you can use those to create tweets ahead of time to make it easier to tweet a live event. The shorter the better. Again, photos and videos if possible. Hashtags that are popular, if you add those to your post, that's a great way to get more eyes on your message, and tag whatever accounts that are relevant to your message. And so for example, earlier on in the pandemic, Governor Lee was hosting daily press briefings. And so we would mobilize constituents and advocates to tune into those briefings and submit comments about issues that they wanted to get in front of the governor and his staff. And so having that direct line of communication is really important. So if you're posting something and you want a particular elected official to see it, you can tag their account. And so I encourage you to sign up for TJC's Healthcare Advocacy listserv. On there, you can select healthcare advocacy, children's health, nutrition, or independence. Independence is related to our work supporting older adults and people with disabilities. So depending on your interests, you can receive the latest information about what is happening in Tennessee related to those areas. And we often share various calls to action for people to email or call or meet with their policymakers. And that is the end. So if you have any questions, feel free to